Do we have enough space to place an implant in this area, or the 1.5 area? If we are just analyzing this model, okay, without understanding, without creating an ideal design in advance, for us, if we can measure here, and we have around 6.5 in terms of width, and we know that this is enough to place an implant and enough to replace the premolar here. Okay, so if we're going to just consider space, this case we'll have enough space to insert the implant. But when we start evaluating the ideal design, okay, when we start understanding where it is the midline of the patient, where we need to place all these teeth, we start understanding the importance of the collaboration between implants and orthodontics. Okay, and in this case, when we plan and we did a setup and we created a design that we can see here in white, we needed to change a little bit the midline. We need to distalize the second quadrant. And look, the ideal position for the premolar, after moving teeth, after positioning in the ideal position, it is more distal. Okay, so this is a kind of case that we see a lot, that patients came to orthodontics with the implant in position, and if the implantologist place the implant here, it will block a lot of our movements and will limit the outcome. Okay, so for this case, we guided ourselves, we guided the twins by this design. So here it's clear that we need to move to distalize the molar, right? So we have here the ClinCheck. Let me move a little bit down the ClinCheck so you can see better. Okay, and by doing this movement here, we are going to open enough space so we can place the implant in the ideal position. Okay, so here the design you saw there in white, we can see here in blue, right? So we need to move this molar inside the design to this ideal position, okay, opening enough space so we can place the implant in a proper position. After one set of aligners, we can have this outcome, okay, and by seeing now, we could move it to a better position, and now the implant is going to be placed in the ideal position. So this is the importance of planning the case, simulating all the possibilities in the computer in an interdisciplinary software in advance, so we can understand better what are the specialties that can be involved, because this case could be solved with an implant here and maybe restorations, but we saw that the design according to the midline to the patient, according to the face, according to area aspects and everything else that we take in consideration, it wasn't in this position but in the white position. So this way we could improve the space for the implant and could allow the implant to be positioned in a better place. Okay, so understanding first where it is the ideal final position, it's always the most important thing we need to do before planning the implants, before starting any treatment. In this case, we could finish with a great outcome after one set of aligners, and the case is ready now, so we can move to the next phase to do the restorations, and we can now place the implant properly in the ideal position. Okay, thanks guys for your attention. See you soon.